So I remember when we got our keys, we were super excited.
Ta-da, this is my room.
And we couldn't wait to get into the house. Over the year, we got to make the house our own.
That right there is my glitter wall. We painted glitter on here.
It's so pink. I got even pink paper.
So when the pandemic hit, I actually caught it early on. I am so happy that we had this house at the time because I was able to seclude myself. It would have been much more difficult in the apartment, and it made it much easier. It really did. Working from home, it was very new. It wasn't as bad because we have this home where we can spread out. So sometimes it's hard for everybody to be on their computers with the live teacher, with everyone talking. Having the space really helped with that. I have seen changes in the children. I noticed that they slept more at the apartment. Here, they're more up. They want to do more. Like Asia here, she's really into art. So I notice how she's always finding creative things to do, and she has the space to do it.
These drawings that I drew that eye, and I drew that, and this, and that.
Before, like when they would get frustrated, they really didn't have anywhere to go to like have that time to themselves. For some reason at the apartment it was more gloomy. In the house we have all this natural light, and I don't know, it just picks you up and makes you more excited and have more energy and you want to do more.
Good afternoon. I'm Nikki Sorum, Senior Vice President of Thrivent Advisors at Thrivent Financial and Chair of the Twin Cities Habitat for Humanity Board of Directors. Thank you for joining us for our 10th annual Women of Habitat Hope Builders Luncheon. We have a fascinating conversation just ahead, focusing on the critical intersection of housing, health, and equity, 3 issues that have been top of mind for all of us over the past 2 years. Before we jump in, I want to remind you that we are here today to support the mission of Twin Cities Habitat for Humanity. At Twin Cities Habitat, we believe that stable, affordable homeownership is absolutely essential for public health, racial equity, and generational wealth building. We know that home is a foundation for strong families and strong communities, and that owning a home can positively impact a family's health and quality of life, both in the short and the long term. We have heard countless times from Habitat clients that owning a home improved their family's health. Angel's story that you just heard is a great example. While she was battling COVID-19 last year, because of her home, she was able to safely isolate from her children. Others have described how their new home helped them breathe easier. No more moldy apartment walls or old carpeting. And when a family has a home of their own, they can control the very air they breathe. They have space to recover when they're ill or injured. And they have the security of knowing that they will have a place to rest at night. Far too many families in our community don't have a safe and stable home that they own. Homeownership is out of reach for many of our working class neighbors, especially for families of color. Minnesota has among the nation's worst racial disparities in homeownership. 77% of white families own a home, compared to just 42% of families of color. And that rate drops to a tragic 25% for Black families in our state. It's going to take all of us working together to address our awful racial disparities in homeownership, in health, and in wealth. At Twin Cities Habitat for Humanity, we are doubling down on our commitment to advance racial equity in housing, and we need your support. You can play a vital role in expanding access to homeownership and creating a vibrant, equitable Twin Cities community. You can start today by making a donation to Twin Cities Habitat for Humanity. Your gift will help make homes more affordable for more local families. Your generosity will open the door so more of your neighbors can experience the transformational power of home. And of course, all the health benefits that come along with that. Please make a gift using the donation form on this page and know that your gift will ripple across neighborhoods and across generations. If you donate $250 or more, your gift will be doubled thanks to Tian Kai and Dan Kuhl, up to $25,000. Please make a gift right now to help us reach our goal of $150,000. And don't worry, you can complete your gift on this page while continuing to watch the program. Now I would like to introduce our fellow Habitat board member, Michelle Robinson, our moderator for today's conversation. Michelle is Senior Vice President of Strategy and Business Development at Vitalant, a nonprofit blood donation and transfusion company. She's a seasoned executive with many years of experience in the healthcare industry. Let's please give a warm Habitat welcome to Michelle.
Thank you for that introduction. And now I'd like to introduce our two individuals that will be joining us in discussion for the next hour. First, we have Dr. Taj Mustapha. Dr. Taj Mustapha has just been appointed as the first Chief Equity Strategy Officer at MHealth Fairview. Until accepting her new appointment, Dr. Mustapha had been a practicing internist pediatrician and leader for diversity, equity, and inclusion in the learning environment at University of Minnesota Medical Center. In her new role, she will lead and craft Fairview's health equity efforts. Thank you for being here today, Taj.
Thank you.
Next, I'd like to introduce Miss Stella Whitney-West. Stella Whitney-West has been CEO of NorthPoint Health and Wellness since 2007. NorthPoint serves residents of the North Minneapolis area, providing comprehensive medical, dental, behavioral, and human services designed to improve the physical and mental and social economic health of the North Minneapolis community. Among her many honors and awards in a Bush Leadership Fellowship and the International Black Women's Congress Community Services Awards. Welcome, Stella, and thank you very much for being here today.
Thank you, Michelle. I'm really, it's an honor to be here with you and to Dr. Taj. This is my first time meeting you, and looking forward to our discussion today. So.
Awesome. Well, I'd like to first start with thanking both of you. Thanking both of you for being in this space at a time such as this. We have been dealing with a pandemic, and unfortunately, disparities of racism that have really shown themselves here in the Minneapolis-St. Paul area. So thank you both for the service and the work that you have been doing over the past 18 months. With that, I'd like to start with our first question of the hour, and that would be, on a personal level, what has been, or what does it mean to you to have stable housing to go back to at the end of a workday, especially during this pandemic and some of the challenges that we have personally been facing in the Twin Cities area? And I'd like to start with you, Stella.
Well, I would say that I am definitely blessed and fortunate that I have stable housing, and that what it means, particularly in this particular time of COVID-19, and even just at the job that I have, that there is a lot of moving parts. No day is ever the same. To be able to come home and know that it's my home. It's I'm not sharing it with others other than my family, grandchildren, and children running in and out. But it is very comforting. It allows me to have space where I can compose myself, where I can gather energy and have my thoughts, and to be able to meditate and to do the kinds of things to re-energize. So there's nothing like having your own home. And there is, from my perspective, in the community that I live, I was born and raised in the Rondo community in St. Paul. And right now with my daughter and son-in-law who have come back home for my daughter and grandchildren, it's like 4 generations that we have claimed the Rondo area. And so it's really exciting for me to be able to share that now with my grandchildren. So some of the same community-based institutions like the Hallie Q. Brown Center that my mother and myself and my daughter and now my grandchildren attended, they're able to. And so it's being able to live that saying where it takes a village to raise a child. And that is exactly what my daughter told me when she said she was coming back home. She says, Mom, because she was in the Atlanta area, and it was that 3rd child, she says, I need my village. And I said, come on home. So that's the exciting part, is to be in my own home, in my community where 4 generations of us have thrived.
Thank you. Thank you. How about you, Taj?
Thank you for the question. And Stella, it's so great to hear your story. I am not a Minnesota native. I grew up in New York and then trained in California and bought my first home in Minnesota. So the home I'm in now is the first time I owned. Before that, it was renting. And when I think about these times, I mostly am remembering back to March and April of last year. And I don't know if you all remember that, but certainly in healthcare, we didn't know what we were dealing with. So we didn't know how long COVID lived on different surfaces. We weren't sure about transmission. We didn't have any data about how what we now know is the Alpha variant affected kids, and I have 2 young kids at home. We still weren't sure how effective our PPE or personal protective equipment would be. And so I have 2 school-age children, and I work in the hospital. So clinically, I was seeing COVID patients. And I remember being, quite frankly, very scared, but also really thankful that I had a home and wasn't in my 450 square foot apartment that I lived in San Francisco, right? That I had a space to come home to, and I could take my shoes off in a place that my kids wouldn't get into, right? Like there was a separate place for my shoes. I had space to actually also be separate from my children, to quarantine from them in a separate bathroom. And in retrospect, probably didn't need to take all those measures, but again, we didn't know. And I could just have some peace of mind, knowing that I could do something to keep my kids safe. And at the same time, as school-age children, they're 5 and 7. My kids had a space to play, both in the house as well as the yard. And granted, I invested in more play equipment than I thought I would ever own, but had space for them where they could move and be active. Truly, that was key for all of us making through the pandemic, getting some of their energy out. So I am thankful all the time for that space, and having a space that, again, that we can make our own and keep safe in.
Thank you. Thank you for that. Yeah, I totally can respect where both of you are coming from for that. And with that being said, elaborate a little bit for what that means on a larger level as we talk about the role of stable, affordable housing, and specifically homeownership for an individual or for a family. And we'll go in the same order. How about you, Stella?
Sure. Home ownership has been shown that it is really the pathway for families to build wealth and actually to build generational wealth. Home ownership has meant that families have access to capital by using their home to fund college education. When you have a home, certainly you have access to not only capital of building wealth, but you also have access and the ability to support other members of your family. I remember growing up when my parents first moved here, and we had cousins and relatives who were coming from Oklahoma, and they would come to our house because my mom and dad were the first ones, and they would stay for a while until they got off of their feet and were able to have their own home. So it became that kind of stabilizing place for the rest of our family as well, that they could come, they could move, they could stay with us for a while and then move on. And I know that that continues to happen in a lot of families, middle-class families, low-income families across the board, that having members of the family that own their own home, they can do that. Because you can't do that when you're a renter, right? The landlord's very strict about who can be in your apartment. But when you have a home, you then have the ability to extend that to other members of your family. And again, it is that pathway, that beginning pathway for so many families of wealth, and a way of being able to pass that wealth on and being able to capitalize on that home for funding education.
Thank you. Taj?
Thanks, Stella. It's hard for me to not answer this as a researcher. So, Michelle, please reel me in if I get too in the weeds. Housing is one of the best researched social determinants of health. So studies have shown that safe, quality, stable, and affordable housing improve health outcomes and decrease healthcare costs. The thing is, those qualifiers are key, right? Because there are health impacts from not having a stable home, and some of them are overlapping with the additional impacts if the home itself isn't a quality environment, meaning both structurally stable as well as clean. And additionally, there's research describing the health impacts of having a large portion of finances going to shelter. And lastly, there's a growing literature describing the health impacts of neighborhoods, both the social and environmental impacts of where people live. So I think, most people know that homelessness impacts multiple facets of health, but it's really important to understand that people who are not chronically homeless, but just face housing instability, which can take the form of moving a lot or falling behind on rent or couch surfing, they're also more likely to have worse health than their stably. So for kids, the health effects include an increased risk of teen pregnancy, early drug use, increased risk of major depressive disorder, as well as anxiety. And for everyone, unstable housing can disrupt employment, make it more difficult to maintain friendships as an adult. And there's been a lot of great research looking into connection between robust friend networks and then positive health outcomes. And unstable housing can impact the ability to attend or pursue education, which of course itself is linked to health outcomes. So on a really basic level, if you aren't stably housed, it becomes logistically challenging to engage in any of these things that are linked to good health, and also just to receive proper services, right? So as a doctor, if I think someone needs home physical therapy, how do I set that up if they don't have a stable home? If someone needs to store their medicine in a cool, dry place or refrigerator, how do they do that if they don't have access to the same refrigerator day in and day out? So those types of really basic things, the intersection of just the healthcare not to mention the other things that impact health, are all tied to stable housing. And I'm so appreciate that Stella mentioned, right, the impact of wealth building, because that's also huge from a generational perspective. And when you look at the history of things that promoted housing, right, so historical initiatives like the GI Bill and things like that, they had generational effects on the families that were able to benefit from those initiatives, which was not everyone. And not just on wealth, but on health indicators like terminal height. You had taller generations because they had better nutrition and access to wealth and average life expectancy for those families. So safe, quality, stable, and affordable housing are central to health, and I cannot emphasize that enough.
Yeah, that's awesome, and it actually kind of speaks to where I was going to go next as it relates to the question. So just staying in that space that we're in and going deeper to, from a macro level, we know, or it just makes sense to what you said as it relates to just stable housing and how it meets, or it is it correlates with health. But what does it mean specifically for us here in the Twin Cities area? Not only as it relates to what you may have witnessed, but also the gaps specifically and what we can do about it. So I guess we talked about it anecdotally, yeah, it makes sense, but what does it mean here in Twin Cities and from what you've seen in your own experience as it relates to stable housing when you have it and when you don't, overall in the spaces that you've been working, particularly in this pandemic season? What do you see? Or have you seen?
Well, I will say, and kind of reiterating what Dr. Taj has said, that relating to her own experience of being able to have space where she was able to isolate from her kids, and being able to making sure that when she came home, she could take off her shoes or even change, so that there way that she could reduce the risk of transmitting any of the COVID virus. One of the things for sure is that in this environment, and we've seen it here all the time, is that when you have multiple families that are in the same house, or that they're moving around, someone has COVID, the first thing that they need to be able to do is to isolate. Well, you can't do that if your housing is not stable, or if your housing is not adequate. That is definitely. And so what happens is that one person in the household becomes infected, and then the whole household becomes infected. And so it was one that we started to see early on. And even when we would ask people, well, is there any way that you could have a bedroom to yourself, or, or how do you figure out a way? So one of the things that Hennepin County started doing early on in the pandemic, and they started doing this not only for the homeless population, was that they started renting and buying up hotel rooms. And for a lot of people that seemed like, well, why are they doing that? Was because we're trying to mitigate or stop the spread, so that you want to make sure that people were in a place where they could be separate, right? And we were able to do that also for some of the healthcare workers, because many healthcare workers, just like Dr. Taj said, they were exposed to COVID as well. And oftentimes they did not want to go home where they could spread it. So that was an issue. I think one of the things that impacts communities, particular communities that we serve here at NorthPoint, was predominantly African American, BIPOC communities of color, is that we see the long-term effects, the generational impact of racism and how these communities have been shut out of the home markets, and how they have been pretty much relegated to certain areas within the city of Minneapolis. So the whole idea of the redlining, the covenant, meant that, and it was not based on whether or not you had the income or not. It was completely based on your race and ethnicity. And so that in and of itself leads to and has led to ongoing generational lack of access to all of the things that being able to live in a home, or being able to live in neighborhoods that are safe, or and we all know that how schools are funded by the housing that is in those communities. Those are where schools get their funding. So all of that impacts the education of a child, where they live. So it's an ongoing issue, and the Twin Cities have been, just as you said, Michelle, has some of the worst disparities.
Unfortunately true. Taj, your thoughts?
I think Stella did excellently. I just want to give a shout out. I'm sure a lot of folks have already seen the wonderful documentary, Jim Crow of the North.
Mm-hmm.
It follows the great work being done by the Mapping Prejudice Project at the U. That documentary, right, outlines the history of racial covenants in Minnesota. And I do think it's important to understand that, right? Because it's just one of several systemic ways that Black Americans, but also people of color in general, were excluded from home ownership. I think it's important to also recognize some of the history, right? Things like the GI Bill, which afforded white veterans a host of benefits like low-cost mortgages, low-interest loans. You could start a business. You had a year of unemployment compensation, right? As well as tuition, right? That had a huge benefit that was generational, right? And property was part of that, because you could pass down that property to your children, who then maybe didn't have to pay a mortgage and inherited that, or they could work or sell that property, leading to increased income, right? Then there was also policies around urban development, right, which literally destroyed Black neighborhoods by building freeways through them. So all of those things that allowed some people to have single-family homes in suburbs or in urban areas of the country, and then forced other people, primarily Black families, to specific and often less desirable urban locations. And remember, part of the decreased desirability of those locations was things like proximity to polluting industry,
Right.
or access to safe and clean outdoor spaces, right? So we need to think, like, as we talked about before, housing is the best research social determinant of health. And because, of course, where you live and play is going to have a tremendous health impact, if we don't focus on housing and neighborhoods and safety and, right, taking care of our exposure to pollution and environmental hazards, right, we're not going to address healthcare disparities. Like, we have to address housing in order to address health.
Thank you. Thank you both for that response. You both have referred to it or mentioned it. In the opening remarks, it went into detail associated with some of the history here in Minnesota. And so Minnesota has one of the worst racial gaps in homeownership of any state in the nation. I know the state also has persistent racial health inequalities. Can you please shed light on how these gaps are linked and share your thoughts on solutions to interconnected disparities in health and housing? And what I'm really wanting is you begin to go there, but just continue to elaborate on that piece of what it is that we can do, or that you're currently doing, to address the known gaps that we have here in Minnesota.
So I think it sometimes helps to think about the gaps as living in two separate buckets, right? There is the bucket of social determinants of health, or what contributes to overall, And housing is a key portion of it, right? So that whether or not it's safe for you to go outside and play, right, is going to impact things like obesity, right, your risk of heart disease, all sorts of kind of later health factors. But then there's also what housing in neighborhood means when it comes to the health care you're able to receive, period. We talked about if you don't have a place to store medicine that needs to be refrigerated, well, you might not be getting the exact right medicine for the issue that you have, right? So there's an actual care disparity comes into play when you don't have access to safe, stable, quality housing. So you're kind of doubly, doubly taxed or doubly injured when you don't have access to stable, safe, quality housing because of the environmental factors and the way it impacts your health kind of risk and the type of care that you're able to get. So both of those factors combine. And so really, I think when you look at how, what is the single best impact you can make, it is things like making sure that all neighborhoods, right, have good, safe streets, clean, good places for kids to play, that the housing stock is quality and safe and up to code, and that people have pathways to ownership. Again, as we talked about before, because of wealth building and the ability to maintain space, that ownership is key, not just the physical environment of being able to rent that type of housing.
Right. And I would add that, and I was going back to what you had said, Dr. Taj, around that when families or groups of people were only allowed to live in certain areas, and those areas, just like in North Minneapolis, are also areas where there are a lot of pollutants and a lot of industry. And that is why we see a lot of children, which is the number one diagnosis that we see, have asthma because of the air quality here as well. The other that we see is that there's just because families are not stable, there is the anxiety that a lot of children and a lot of families feel because they don't know, if they're going to be moving again. And we know that the schools report that when they have children that are moving, and it's not unusual that you would have a child moving 5-6 times during a school year, that is a direct impact on their ability to perform in the classroom. And children in particularly are so socially connected, and if you continually to move and have to make new friends again, and how difficult that becomes, and it is a cycle that is very difficult to break. The other thing that we have not mentioned is the fact that there is just the overall cost, the percent of someone's income that they're spending on their housing. And we know that for most families that are low income, or certainly families that are in unstable housing, they're spending well over 30%. Some are spending 50% of their income on housing. So if they're spending that amount of their income on housing, that doesn't leave enough money for food. It doesn't leave enough money for adequate childcare. So hence puts children at risk, because now working parents can't afford, right, childcare. So they maybe have older children who are watching younger children, and that puts those children at risk. And then there's, so if they're are spending a significant amount of their money for housing, then they're not getting nutritious food or healthy food. It was one of the reasons why at NorthPoint we've always had a large food bank, and that we make sure that families have access to food. We always make sure that when any families come into our clinic, so we don't separate the housing, the employment, the food from healthcare. In fact, we see that it is the continuum, just as you mentioned, the social determinants of health. And we know that for a fact that actual clinical care is only about 20% of what impacts healthy outcomes. It's the 80%, which is the housing, it is the education, it is the access to safe. And we really in North Minneapolis are just in a lot of pain because children have been killed in neighborhoods where they are not safe, where now because of the violence in many of their neighborhoods, they're not able to go out and play. So if children are not able to go out and play and to exercise, and then that has a direct impact not only on their physical, but also their mental well-being. So having safe, affordable housing is really foundational to the overall health of children and families. I think that as healthcare providers, there are conversations that we are having with health plans, because we've always said that what if, right? That with your health plan, with your health dollars, you could buy housing, you could buy food. We have a program here that was funded, and I believe it's Blue Cross Blue Shield, Veggie RX, where our doctors, our providers, that in conversations that they have with a family, that if they know that they're not getting enough fresh produce, they literally write a prescription that they then can take to the farmer's market and get access to fresh fruits and vegetables and things of that nature. So we need to be able to get to a place where those healthcare dollars are being spent to where they're most critically needed, is at 80% of those social determinants of health, and not just the clinical care.
Thank you. Thank you both for that. I appreciate how it's linked together. And one of the takeaways that I'm hearing from you, Taj, and I wrote it down because I didn't want to forget it, is where we live and play impact our health. Mm-hmm. And then you started delineating the difference between health care and health. And we're both short on that. And I also love how you linked it as it relates to that 80%. So 20% is associated with that, but the other 80% is very much dependent as it relates to that environmental piece. So I like how both of those have matched together. So as we continue on this and we talk about health, how about that mental health? Is there evidence of the role that housing and homeownership play in mental health? Taj?
So there definitely is, and I know NorthPoint Health Wellness does a lot of work in this area. So I'm going to speak to this primarily as a pediatrician and talk a little bit about kids, if that's okay.
Yes.
So, you know, I know I mentioned some of the risks of unstable housing for like youths, but school-age children also face health risks from unstable housing. So as a pediatrician, right, one of the things that I think about when I think of children is their development, right? Like they're learning about the world. So on a really basic level, children require stability to learn and develop. So if you think about the way kids learn, they learn kind of through experimentation, right? They learn about what surfaces are harder or softer, what objects in the room are stable when you grab them, which ones crash down. So infants and toddlers are constantly conducting experiments, right? I think about it a little bit of a scientific bias, but that's how they learn. So now, if you're conducting experiments, but you keep changing the variables, it takes a lot longer to figure out the results of those experiments, right? So if you aren't in stable housing, the variables keep changing, right? So kids have then delayed achievement of their developmental milestones. And that can be like things like gross motor milestones, right? Just even getting up and walking, to then even things like, some of their social milestones or how they interact. So on that really basic mental developmental level, even young kids are affected by housing stability. And here's the thing, right? Kids are in fact resilient, and you can see that when they enter into a stable environment, they start to catch up. But getting into that stable environment is key. And when you think about how the pandemic affected kids, right? Housing stability really accentuated the differences and kind of highlighted the differences between stably housed and unstably housed children. Because, right, obviously all children have been affected by the pandemic, but children with stable housing literally had a stable touchstone in the world, and the world was changing so rapidly around them, right? So I'm thinking about one of the parents of one of my patients who was talking to me about how her and her daughter were spending time painting the walls of her room. So this was back when we were really on lockdown. So they painted the walls of her room to look like some of the favorite places that she couldn't visit, right? So there's one wall that looked like her favorite park. And I don't know if you remember last summer when we took all the swing sets out of like the public parks and everything, right? Like, because we didn't know what transmission was like. So one wall was painted like a park. There was another wall that was the Children's Museum. And honestly, I don't remember what the third wall was, but she was able to make the space her own. And here's the thing, you can't do something like that when you're renting, right? Your landlord is going to just let you paint your kid's room with fun scenes. So I can't tell you how many parents who used to live in apartments commented about how lucky they felt to have a home where their kid needed to run around and scream in the house during the day, could do so, could let out some steam, and it didn't disrupt upstairs or downstairs neighbors. So really, for kids, right, having that space that they can own and kind of put their stamp on and give them some comfort and stability, and having space to move in, play, and be loud, because kids are loud, those are the things kids need for their mental health and stability.
Right. And I would just add, we always have a saying here that healthy kids come from healthy parents, right? And so when we see that the mental health of a parent, of the mother, we know that impacts, right, the child before it's even born. We've had groups here at NorthPoint where we work with pregnant women who have, and across the board, whereas they may come in and they're diagnosed as having a mental illness. When you look at all of the other factors, housing is one of them, that they don't have stable housing, they don't live in a safe environment, and all of that translates to poor birth outcomes. And so one of the things that we have found that, first of all, getting to the women early in their first trimester and being able to help to resolve some of those issues, making sure that they have a safe housing, number one, and then being able to have them to start to work on those feelings of anxiety, those feelings of, and some of them have been subjective to abuse as well. But you want to make sure that it begins foundationally with their living environment. Where are you living? Who are you living with? And can you get into a safe living environment? Once you make that big move, then it's easier to work on the other. And we know that connection of mental health, the mental health of the parent, of the mother, translates to the overall well-being of that child. When that child is in the womb, mothers that are stressed, that don't feel safe, are not in a safe environment, are generally going to have poor birth outcomes. So when we're working with women and mothers, those are one of the first things that we start working on.
Thank you. Thank you. Wow. I'm going to switch gears a little bit and talk a little bit about policy or community. From a policy or community level, what do you see as solutions to the challenges that both of you have talked about?
Well, one that I've mentioned here, and I'll just say that so NorthPoint is part of a ACO, Accountable Care Organization, Hennepin Health, and so as I talked about the fact that changing policy in terms of how healthcare dollars are spent. We need to move beyond just saying that healthcare dollars are only spent on that 20%, that clinical care, and start looking at that those healthcare dollars are being spent on that 80%. Those are policies, and particularly for low-income families who are on medical assistance. Those policies come from the state and the federal level, and it's so important that that we advocate for that, because there needs to be that understanding that health and health care, right, are two different things. And the most important thing is addressing health and all of the components that contribute to health. Healthcare is the business, right? And when you look at healthcare as a business, it is a big business. It is a multi-billion-dollar business. And particularly in this country, right? Why is it that when you look at the amount of money that we spend on healthcare, we have some of the poorest health outcomes? We have some health outcomes, particularly for BIPOC communities, that are no different than third world countries. So what is it that is going on here? Because it doesn't equate to the amount of money that is available. It equates to the policies in terms of how that money is being distributed and where that money goes.
Thank you.
I completely agree with that. I would encourage people to look up some of the work that Kamara Jones has done. She speaks about this quite a bit, and she's a physician and public health scholar, and she often talks about right, if you think about health, and you think about you have people who are on top of a kind of on top of a mountain, and there's a cliff, right? And at the bottom of the cliff, there's an ambulance. And we think about where we're spending our money. A lot of money is going to that ambulance, and there's not enough money going to keeping people from falling off the cliff, right? And so how do we think about healthcare organizations starting to be in the business of a health organization, right? How can we as organizations really encourage our current structures to support health and not just the care provided? And that does require a mental shift, right? And it requires that we also embrace the fact that we have some autonomy in making that shift. The VeggieRx program is a great program, right? That's one of the programs that we're involved in as well. But there's even more than that, right? The VeggieRx program is maybe like a net halfway down the cliff. It's not keeping people from falling off the cliff. So I think really thinking, how can we look further upstream and invest in health? While also, right, we need to be able to treat someone's crushing chest pain. So we need the ambulance there. I'm not saying get rid of the ambulance, but we need to just shift the way we think about our interventions so that, yeah, we have the ambulance, but we're directing a little bit more resources towards the top of the cliff.
Sure. I appreciate all the comments. There's so much that's running through my mind associated with just wellness and the wealth associated with wellness. I also know from a previous life that I had, just the piece that you referred to regarding food and the idea that food is the wellness piece. In my previous life, it was they the business where I was in, they had, it was a hospital pharmacy, but they spelled it FARM. The whole idea of the food and things of that nature being so important because it is that other 80%. So I appreciate hearing that. We are approaching our last question, and it's really kind of open-ended because we've covered a lot of ground today. It's more associated with if there's one thing you want everyone here to take away from this discussion, what is it? And what's one action we can each take as Habitat supporters to address the health inequity and contribute to the positive change? And I'm open to either one.
I'll start. And so one thing that I think that is so important for all of us, and particularly now in this time, and I try not to listen to the news, but I'm a talk radio buff, so it's always on in my car, and I think about just the environment that we are in, where we are more separate than ever before, and where we are as a society, as a country, where we are pointing the fingers at and looking at the other, and thinking that we can build walls and contain people. One thing that we have to know, that we are all connected, right? We're all on the same planet. We're breathing the same air. We all have that responsibility. There is not a wall that we can build to keep people that we consider others separate, and somehow or another we're going to be able to flourish. We have to understand that what impacts your neighbor, what impacts others in a community that you may not live in, but it's going to impact you. So we need to work collectively together, because we only have this one planet. We all breathe the same air. You cannot build a wall tall enough that's going to keep the air out. So it's important that the air is clean. It needs to be clean for everyone. So we need to start thinking as a collective, that what impacts one of us impacts all of us.
Thank you. Taj?
Oh, that was so beautiful. I was going to get real granular. So I co-sign everything Stella just said, and I would just say, I think if people take away one thing from this larger conversation, right, it's recognizing that safe, quality, stable, and affordable housing is a key contributor to good health, right? So when you start thinking about real, solutions to affordable home ownership, not Section 8, but home ownership, it requires things that a lot of people might not want to talk about, like development of affordable housing throughout all neighborhoods. Mm-hmm. Some of the most vibrant, safe, diverse, and thriving neighborhoods are mixed income. And to be clear, this isn't just an urban issue. This is a suburban issue, a rural issue. We need safe, quality, affordable housing everywhere. So supporting your local policies that promote affordable home ownership in your neighborhood is going to make a significant difference in the health of all communities. And it's going to address longstanding disparities that were just created by past policies. So think about what you can do locally, because there are things you can do. And Minnesota's made some excellent moves over the past year, but there's still work to be done. So support affordable housing, not just in general, but where you live.
Thank you. Well, I'd like to thank you both. Thank you for your time. Thank you for your insight. Thank you for the work that you're doing in this space. And yes, I totally agree with you, Stella, that healthcare is a business, but it's absolutely a business where you got to have a heart. Mm-hmm. So I appreciate both of you having a heart and just a mind to share and to help those that need the care in every level that we've talked about. With that said, this concludes our discussion. And again, I appreciate just your time with us today.
Wow, thank you so much, Michelle, Stella, and Taj, for a thought-provoking conversation. As I listened to the discussion, I couldn't help but think of the thousands of children who are growing up in Habitat homes across the Twin Cities. Thanks to generous people like all of you here today, those kids will experience the stability and the safety of a home that their family owns. And that stability continues for generations as families build wealth through homeownership and pass it on to their children and to their grandchildren. I was also reminded of Angel's story that we heard earlier. Angel was able to isolate from her children when she had COVID-19, thanks to the space in her Habitat home. And now Angel and her kids are truly flourishing. Though there are so many more families, just like Angel's, families who are ready to be successful homeowners. They just need a partner like Habitat to get there. If you have not already, please be sure to donate before you sign off. Remember, your gift of $250 or more will be doubled thanks to a matching gift provided by Tian Kai and Dan Kuhl. After you donate, send one friend the link to this page and ask them to make a gift too. If each of us asks just one friend to donate, imagine how many amazingly generous people we can reach. Before we go, I'd like to recognize the Hope Builders Luncheon Committee for their tireless work on today's event, our presenting sponsors, Dominion and Wells Fargo, for their financial support, and all the other generous companies and individuals who've acted as sponsors and event ambassadors today. Many thanks again to Dr. Taj Mustapha and Stella Whitney-West for sharing your knowledge and insights on this complex topic, and to our moderator, Michelle Robinson. And finally, thanks to all of you for joining us today and giving generously. I look forward to continuing our work together to create a vibrant, equitable Twin Cities community.